I was like tired all the time, and I couldn't figure out why. I know I'm getting older, but I'm not that old, and I was just like, man, I don't want to be this old person. I want to be fun grandma, so, but I still wasn't thinking about having an ablation done. I just thought maybe it was just something I was going to have to just deal with, right? I started having weird feelings in my chest to the point where I was calling the doctor's assistant on the phone. She happened to answer and walked me through kind of what to do to see if we could get my blood pressure down and my heart rate down, and we did.
Atrial fibrillation, or AFib, is a disease that affects the electricity of the heart. With AFib, the top chambers of the heart stop squeezing, they're just quivering. Some people may feel that as shortness of breath or palpitations or fatigue, dizziness, but it also increases the risk of formation of blood clots inside the heart. This can cause strokes, heart attack, and heart failure, which could be fatal.
So they called me into the office and recommended that I do an ablation. That was like just such a blessing right there, to have a doctor that knew exactly what I needed to have done.
Ablation is a specialized treatment that is done for AFib patients, a minimally invasive procedure. With that treatment, she was able to maintain being in the normal rhythm without having to take any medicine for that.
The day that I was there for the surgery, my heart was in AFib. All the nurses kept coming in and saying, "Do you know that your heart's in AFib?" I'm like, "Yes, I do. I can feel it." I guess a lot of people don't know if their heart's in AFib, but I could always tell when mine was. And had the ablation done and could immediately tell that I felt better. Within 2 weeks when I went back to visit Dr. Bearcat, I said, I don't think I realized how bad I really was, because I feel like a different person.
Tracy is an active person. She goes to church, she has grandkids, and she enjoys spending time with them and doing activities with them. When we did the procedures for her and we were able to control her AFib and take her off the medications, she's now back to enjoying her life and doing everything she likes.
And then all of a sudden I'm like, okay, what can we do now? I feel good. Let's go do something.